Believe in love, others believe there's no God. I believe there is a God. Some believe in science. Many believe only what they see. Some also believe everything, and others believe nothing at all. But all these things, faith, science, God, and belief, all come from what you hear. There's no one actually watching or listening right now who is older than science and the science of vaccination. They outdate all of us. So you're not alone if you doubt or resist vaccination. Your ancestors did, with myths and superstitious arguments. And so tonight, we want to probe your doubts. Not just that, we shall probe the science of vaccination as well and try to bust the myths with a sledgehammer of real empirical facts and truths. Welcome to The Probe tonight. My guest is the Programs Manager, Expanded Program on Immunization at the Ghana Health Service, Dr. Kwame Amponsah-Chiano, and he has answers to all your questions tonight, loads and loads of them that you've sent already. But before him, President Akufo-Addo has a message for us. I'll take you to the Jubilee House for update number 24 shortly. But remember, The Probe is live on the Joy News channel, also on Joy 99.7 FM, together with a dozen affiliates across Ghana. MyJoyOnline.com, we're live as well. On YouTube, on Facebook, on Twitter, we got you covered. This is interactive, so do send us your messages. Fellow Ghanaians, let's go to the Jubilee House now.
Fellow Ghanaians, good evening, and thank you for welcoming me into your homes once again. You're doing so on one of the sacred days of our nation, 28th February, when the 1948 Christiansborg Crossroads shootings occurred 73 years ago, which led to the martyrdoms of Sergeant Ajete, Corporal Atipo, and Private Odate Lamptey, martyrdoms that ignited the nationalist movement and led us to the freedom we enjoy today. Let us observe a moment's silence in honor of their memory and the memory of all the faithful departed patriots who helped create our nation. May their souls rest in perfect peace. Fellow Ghanaians, since I last spoke to you a month ago, a significant development in our fight against COVID-19 has taken place in our country. In the course of this week, Wednesday, 24th February to be precise, we took another concrete step in our quest to rid our nation of COVID-19, with the arrival in the country of 600,000 doses of the AstraZeneca vaccine, the first consignment of many more to come. I indicated in update number 23 that the earliest vaccine would be in the country by March. However, by dint of hard work and sheer determination, government was able to secure the first batch of vaccine doses in February, a month ahead of schedule. We are the first country in the world to be recipients of vaccines from the COVAX facility. And I want to express my appreciation to members of the COVID-19 task force, which I chair, and to officials of the Ministry of Health and the Ghana Health Service for this commendable feat. The vaccine deployment plan we submitted to WHO, which unlocked this consignment, was well received. They've done a yeoman's job, and our nation is indebted to them. We're grateful also, naturally, to the contributors and managers of the COVAX facility. The AstraZeneca vaccine is one of two vaccines that have so far been approved and declared as safe for use by the Food and Drugs Authority, FDA. With the process of certification currently ongoing for the other vaccines, the range of vaccines available to us will increase. This will facilitate our ability to reach our target of vaccinating 20 million Ghanaians by the end of this year. Through the National Vaccine Deployment Plan, our population has been segmented into 4 groups, and this will determine which section of the population gets vaccinated at a particular time. Group 1 is characterized as, quote, persons most at risk and frontline state officials, unquote. It includes health workers, frontline security personnel, persons with underlying medical conditions, persons 60 years and above, and frontline members of the executive, legislature, and judiciary. Group 2 is made up of other essential service providers and the rest of the security agencies. It includes water and electricity supply services, teachers and students, supply and distribution of fuels, farmers and food value chain, telecommunications services, air traffic and civil aviation control services, meteorological services, air transport services, waste management services, media, public and private commercial transport services, the police service, armed forces, prison service, immigration service, national fire service, SEPS division of the Ghana Revenue Authority, and other members of the executive, judiciary, and legislature. Group 3 consists of the rest of the general public, that is, all persons over 18 years, except for pregnant women. The final group, that is Group 4, will include pregnant mothers and persons under the age of 18, and they will be vaccinated when an appropriate vaccine, hopefully, is found, or when enough safety data on the present vaccines is available. Special arrangements will be made for persons with disabilities who fall within these various groups. So from Tuesday, 2nd March, to Monday, 15th March, 2021, the Ghana Health Service will begin deployment of the 600,000 AstraZeneca vaccines, with persons in groups 1 and 2 being the target of this first vaccination campaign. It will be conducted in 43 districts, which are the epicenters of the pandemic in the country. There are 25 in Greater Accra, 16 in Ashanti, and 2 in the Central Region. The Ghana Health Service, as from tomorrow, will give precise details. Whilst we are initially concentrating on the 43 epicenter districts, preparations are being made for the vaccination of 20 million Ghanaians through the deployment of some 12,071 vaccinators, 37,413 volunteers, and 2,079 supervisors for the entire vaccination campaign. Fellow Ghanaians, I know that there are still some who continue to express doubts about the vaccine. Others will express reservations about its efficacy, with some taking sides with conspiracy theories who believe the vaccine has been created to wipe out the African race. This is far from the truth. Our domestic regulatory agency, FDA, one of the most reputable in Africa and in the world, has certified the safe use of the vaccine. It will not do so if it had any reservations about the safety of the vaccine. And I've gone on record as saying that no vaccine will be deployed in the country for use without the express certification of the FDA. Taking the vaccine will not alter your DNA. It will not embed a tracking device in your body. Neither will it cause infertility in women or in men. As your president, I want to assure you that the vaccine is safe. That is why tomorrow, on Monday, 1st March, ahead of the commencement of the vaccination program on Tuesday, the 2nd of March, my wife, the First Lady, the Vice President, his wife, the Second Lady, and I will take the vaccine publicly at 2 health facilities in Accra. Key public officials, such as the Speaker and members of Parliament, the Chief Justice and Justices of the Superior Court of Judicature, the Chairperson and members of the Council of State, the Chief of Staff and senior officials of the Office of the President, and prominent personalities like some eminent clergy, the National Chief Imam, the Asantehene, the Garmanche, and some media practitioners will also on Tuesday take the jab publicly. This is being done because the vaccine will help protect us against the impact of COVID-19 on our health. It is also a major catalyst to restoring livelihoods and the national economy to the robust level it belongs. I encourage faith-based groups, civil society, media, and all Ghanaians to support the public education campaign associated with the exercise. We need all hands on deck to make this a success. Furthermore, I want to reiterate my determination that we should manufacture vaccines here in Ghana. To this end, a committee has been established under the chairmanship of the former Minister for Environment, Science, Technology and Innovation, the world-renowned scientist, Professor Kwabena Frimpong Boateng, which is formulating a concrete plan of action towards vaccine development and manufacturing. Fellow Ghanaians, the rollout of the vaccination campaign does not mean we should let our guard down and discard the safety protocols that have served us well thus far. We cannot afford to let our guard down. Let us continue to wash our hands under running water, maintain social distancing, refrain from shaking hands and hugging, and most importantly, wear our masks. We must remember that the virus continues to jeopardize our lives and livelihoods. As of Friday, 26 February, the total number of active cases stood at 5,444. Our daily infection rate is 400, and 77,972 recoveries have been recorded. Since I last spoke to you, 191 more people have sadly passed away, bringing the number of cumulative deaths to 607, and 24 persons are critically ill. Out of 69,352 schools in the country, 207 have reported cases of infections. The number of active cases in our schools is now 282. So until further notice, all the restrictions as announced in my last address remain in force, and the police will continue to ensure compliance by all and sundry. Eduanom, eduro na yɛde bɛsa yare no, ebi abeduru yɛ memu. Efi brada ɛkɔ, yɛbɛhyɛ ase awɔ paneɛ no. Menim sɛ ebinom suro paneɛ no. Nti ɔkyena, me ne me yere First Lady, Vice President ne yere Second Lady, ɛne mpanyinfoɔ titiriw bɛwɔ paneɛ no. Na tumi ahyɛ obiara nkran sɛ bɔne biara ɛni paneɛ no ho. Mesrɛ mo, ɛduro no aba no ɛnkyerɛ sɛ yɛbɛgyae mask no hyɛ anaa yɛbɛgyae yɛn nsa hohoro. Yɛnkɔ so ndi nhyehyɛeɛ no so, na no ɛna ɛbɛboa yɛn. Anyameme, Chufa ni woke babu wa here. Yelahi na eko ibasheshi. Keje jufo ke ya Oba boy chufagbu. Iliake me sure chufagbe ye. No e war mike inye fatalo. Wa vice president ke he fatalo. Ko nukpa kume bagbu chufan koni ewo mofia mohiwale. Ake ifon ku be chufan he. Mi panyefai. Wakakpa maske wo. Waya no ni wo forward. Ni wo ye hela agbotiano to fe no ni ba wawo. If all of us stay the course and adhere strictly to the protocols, we will emerge out of this pandemic even stronger than before. This is my charge to you this evening, my fellow Ghanaians. There is light at the end of the tunnel. We dare not give up all the hard work at this point in time. This too shall pass because the battle is still the Lord's. May God bless us all in our homeland Ghana and make her great and strong. Thank you for your attention and have a good night.
President Akufo-Addo with update number 24 just gone by. This is The Probe here on the JoyNews channel, also on Joy 99.7 FM. And Dr. Aponsa Chiano is my guest in the studios. And of course, just a brief wrap of what the president has been saying. So far, we have 5,444 active cases. Infection rate is at 400. Recovery 77,972. Deaths, unfortunately, 607. 24 persons critically ill as we speak. In schools, we have 282 active cases since our schools reopened. 207 cases were recorded and 282 active cases as we speak. Restrictions still in force. We have a rollout of vaccines. We know that we received 600,000 doses of AstraZeneca vaccines under the COVAX facility this week, or is it last week? And 20 million Ghanaians will be vaccinated under the program. So 43 districts, which are epicenters of the coronavirus, will be, vaccinated. That's where it will start from. But of course, Dr. Chiano is here. He's in charge of all this. So he has all the details and answers to your questions. We're hoping to get the Information Minister, Mr. Kojo Ponkrumah, via Zoom. Okay, I'm told that he's joined us via Zoom. Thank you. We'll start with him. Dr. Chiano, welcome. Thank you very much for your time.
Thank you very much.
It's good to have you in the studio. There are lots and lots of questions. I'm sure you're ready to give us answers to them. But let's bring in Mr. Ponkrumah, Information Minister Designate. We're grateful for your time on The Probe tonight, sir.
Thanks for having me, and good evening to Dr. Chiano.
Good evening, Honorable Minister Designate. Happy to hear your voice.
Well, are you ready to be vaccinated, Mr. Ponkrumah?
Well, yes, I am.
Okay.
I'm looking forward to my my shot, I think maybe on Tuesday.
Okay, so since we heard that the president and the wife and the vice president, just the announcement he just made, a number of people are asking a few questions. How sure are we about at least how is he going to be vaccinated and all that? Are we sure that he's safe to do this? Who is going to do it? I'm sure Dr. Chiano has some answers to that, but since you are the Information Minister Designate, some assurances that people want to hear.
Very sure that the president and his wife, the vice president and his wife, and senior government officials who will be taking the shots are all safe. We are sure because Ghana's Food and Drugs Authority has had the opportunity, first of all, to assess all the paperwork associated with the AstraZeneca vaccines which we have in the country. I've also had the opportunity to follow the clinical trials, and I've also, as a third level, examined what has transpired in the various countries where these vaccines have been used, and they are pretty comfortable that it is safe and efficacious. As it came into the jurisdiction, Dr. Chiano's team that has been responsible for storing it under the necessary conditions assures us that it's been well stored. And so we are pretty comfortable. We're comforted by the assurances that have been given us by our scientists and public health experts.
Well, so we talk about the rollout, at least for the executive, the judiciary, some clergy. We've talked about we've heard about the Asantehene and some media practitioners also that will be partaking in this, aside the main 43 districts that will be done. So maybe you just take us through it briefly. At least we heard the president talk about himself, the wife, the vice president, the wife, some judiciary, clergy, Asantehene. Are there other members of the religious bodies, of course, that are also joining? What exactly are the details?
Well, so you would have a number of religious leaders from the Christian and Muslim communities. You have a number of traditional rulers who would also be taking their shots. You would have senior security officials as well as senior health and public health officials as well. I've received a list of some senior media colleagues who would also be taking it. I didn't see your name on the list, but a good number of persons in those categories, as well as the Speaker, the Chief Justice, etc. The understanding that we have is that while a lot of people desire us to do the right thing, people are skeptical, and it's understandable. But that is why we need to drum up a lot of public education, and that's why we need leadership to also demonstrate to the Ghanaian people that it's safe and it's efficacious. Let us take these shots to build the kind of antibodies we require to protect ourselves from severe disease.
Well, my family will be very happy to hear that my name is not on that list, though, but that's fine. But people are asking that is it a different vaccine that you are giving to the president, members of the judiciary? Is it different from what the ordinary Ghanaian will also be getting?
No, all that is available in the country right now are the AstraZeneca jabs, or what we call the COVID shield. I'm sure Dr. Chiano can speak to the batching and all of those ones, but we don't have any other vaccines in the country currently. This is all we have. The same 600,000 that we have is what we'll all be taking as a fair shot. And then we're expecting that we'll get some more of the same AstraZeneca, and then hopefully the Sputnik V that has been approved by the FDA. And then as others are approved, because you remember the president's commitment is that nothing will be introduced to the Ghanaian population that has not been FDA approved. So as others are approved, they will also be introduced to augment the numbers that we have until we hit that hopefully 30 million plus Ghanaians.
Okay, so finally, before we let you off, but I'll check if we have some questions from the public for you as well, if you could kindly stay with us. But let's talk about this committee that has been put together under the chairmanship of former minister, Professor Kobna Frimpong-Boateng, on making sure that we're able to manufacture the vaccines here in the country. Exactly where are we with that process?
Started work already. There were actually a number of organizations that had expressed interest using the framework for medicine and vaccine production the world over, where somebody may have the patent rights, but may also be able to license a local producer to use the same formula and produce sometimes under a local brand name, etc. So already some had expressed interest. The work of the committee is to, among other things, standardize a framework that allows local Ghanaian companies that want to perhaps receive licensing from international firms that have already been certified and have figured this out, so that they can produce the local versions of it. What that will mean is that you'll be able to save some more money, and you'll be more assured of having dosages of it within your jurisdiction, as well as knowledge transfer. For those in the labs who continue to work with the African Alliance to explore the possibility of some vaccines, if by the grace of God, they are also successful in getting an African version, bless them. That will also be added to the pool.
Okay, well, so let's get into the questions, because Dr. Chiano, there are lots and lots of questions for you. But Mr. Oponkuma, please, you could stay with us via Zoom. If we have any questions for you, then we can come to you on it. Thank you. But Dr. Chiano, let's get into the first batch of questions. But before then, good to see you once again. Are you ready for your vaccine?
Good to see you, yes. I can't wait.
You can't wait,
yes,
okay, great. Good to hear that. But let's roll out the questions at this point. There are a number of them. Let's go through them. So the very first one, we start on WhatsApp. It says, what are the processes the Ghana FDA is supposed to follow before approving a vaccine for use in the country? Were these processes followed? And if they weren't, why not? Are we as a country also putting in place protocols to help us quickly detect the level of efficacy and when problems also arise in the population? So that's our first question from Israel. We'll get into the next one. But whilst we wait to get the next one, Dr. Chano, one question that is coming in about the FDA processes, how sure are we about the process?
Yes, I am sure the processes were followed, but I believe that the FDA will be the best people to answer. Okay. But we've been working with FDA for God knows how many years, and we know how rigorous they are. They're actually maturity level 3, which WHO has certified. So we have no doubt. What that means is that they are very, very high on the ladder in terms of regulation, and therefore we trust all they do.
Okay.
And as I said, we work with them quite a lot, so I know they are rigorous.
Okay, so let's get into the next one. I don't know if Mr. Oponkuma want to add to that very first question, but let's get into the second question, 49. It's still on WhatsApp. Dawn, do they anticipate any damning side effects since we all have different reactions to stuff like this? Sickle cell patients and HIV positive people, their side effects could be very dangerous, he says. Then this one says, hello, doctor. Many residents believe the vaccine is to control childbirth to help government sustain its pro-poor initiatives. How true is that, he's asking. Let's take a final one in this batch. If you are fully vaccinated and can prove it, do you still need to pay the $150 test fees at the airport? Celine is asking. Okay, so birth control, I'm sure these are some of them.
Yeah, these are interesting questions sometimes when you hear. It's always the African talking about infertility and impotence. But these, as it were, falsehood started way back when the first vaccine was actually delivered, or deployed. So I have a publication of vaccines causing infertility in so many countries, always vaccines leading to infertility and so on and so forth, since 1936, and I have that.
And it hasn't been proven.
And it's the same vaccines that we are using. For example, Ghana's EPI started in 1978. And so I'm sure you had all the gamut of vaccines. Are you infertile?
Well,
I don't think so.
That's a personal question.
Yeah, I know. Yes,
well, but there's another one asking about anticipating any damning side effects, those especially with sickle cells and HIV positive patients.
Actually, what the issue is that every vaccine, every drug, every medication has side effects. It's about benefits and risks. Otherwise, we won't even live life, because crossing the roads itself is a risk. You take a risk. That's why you look left, right, and left again. Otherwise, life ceases to exist. And so once you have benefits outweighing the risk, then it's for public good. And so that is why we put measures in place to monitor safety. And if there's an issue, we tackle it.
But we are trusting people like you with our lives.
Yes.
When it comes to this, because crossing the road, that is within my power. This is not within my power. So we trust you to be able to do that. So how are we hoping that the risks are minimal? That
is it. That is why we give you the assurance that we have put measures in place so that should there be any issue, we'll pick it up and manage it. And so for us in EPI and for our colleagues in FDA, safety is paramount. That's the first thing before we even talk about efficacy. And so we have structures in place, right from national level, regional, district, sub-district, for which we will monitor the safety of the vaccines.
Okay. But Mr. Oponkuma, if you're still with us, since the vaccines arrived, have we done any tests, for instance? I know that the FDA has approved and everything, but I'm sure government is interested in actually seeing that once you put it, maybe there's a guinea pig or something that has been used, for us to know that when this is used, this is what happens, and then so that we can minimize the risk in it, because beyond the assurances, people want to see something and be sure that this is what it is. Has something like that been done?
It starts off from the question of safety that Dr. Chen was speaking to, and then I'll even go back to your $150 question. So Ghana's Food and Drugs Authority has actually got officials who work with the WHO. And so even before the WHO approves a vaccine like Covishield. Ghana's officials from FDA, at least they have at least one person, have had an opportunity to be in the labs there and to be part of the processes and to be comfortable that it does not hold anything untoward, even in the labs, and then it's being used on whether guinea pigs or monkeys, etc. Before the clinical trials and then its usage on human beings. And so Ghana's FDA has followed the processes all through and is comfortable that there's nothing untoward about this. Now, as the vaccines are brought into Ghana for certification, they look at the paperwork, they look at the samples that are brought in, they do the necessary tests before they certify. And then when the batches are coming in, and perhaps Dr. Achenu will speak to the issue of batching, when the batches are coming in, every batch that is manufactured comes with certification from the labs, considered and signed off here when they arrive. And so from what they give us reason to be comfortable about, there's nothing untoward about this. And we don't have to heighten apprehensions about that. Now, the airport test protocols were reviewed to $50 for Ghanaians and other ECOWAS nationals. It was also reviewed to allow Ghanaians who have tested or persons who've tested in Ghana are going out and are returning within, I think, a 7-day period, no longer to require the PCR test before they onboard from there. But that review did not include a protocol on vaccination that if you've been vaccinated, you do not take the tests.
Okay.
No, that has not been included in it as of now. If there's a further review to include it, we'll be happy to let you know.
So you still have to take the test even though you've been vaccinated outside Ghana. Once you're coming into the country, you still have to be vaccinated. Well, but if you're vaccinated, will you still get COVID?
Well, yes and no.
Okay.
Okay, so there's no vaccine that is 100% effective. We don't have that technology yet. So you still have some percentage of people.
What's the percentage?
It depends. It normally will range between 50 to about 5 or so. Let's say 5 to 50%. Depends. So that's why normally they will talk about an efficacy, effectiveness, and so on. So it depends on the individual vaccine. So for example, measles vaccine. If you take the first shot, you have 85% chances that you won't get the vaccine, you won't get the wild virus and get disease. So there's still a 15% chance of getting it. So that's why we give a second dose so that your chances of getting the disease is reduced. However, in an outbreak setting, what you want to do is to break transmission. Once you break transmission, the outbreak is over and you don't worry about somebody getting it. And that is why you need a critical mass to get vaccinated within a certain period. So therefore, the issue of reinfection doesn't come in, because it's only when the transmission is still ongoing that is when you get reinfection. But once it is broken, then you are free.
Okay.
So it is very important to get that critical mass.
And that's the 20 million that
yes,
we're talking about
minimum.
within the 43 districts, which are the epicenters. And
the 43 districts is just a small group of people. It's because of the very few doses we have, that's why. But it's the entire country that we're going to cover with the 20 million.
Okay. Oh, we're more than 20 million.
Yes. Traditionally, you would want to cover everybody. But there are some who, for now, cannot be covered because we do not have enough safety data. As I told you, safety is paramount. It's safety first before we talk of efficacy.
And that includes the pregnant
women
and
children.
18.
Correct.
Okay. Well, let's get into another batch of questions. There are questions about whether it should be mandatory. I saw one earlier, and we have more coming in. So, Mr. Oponkuma, for instance, we have the members of the judiciary who are supposed to be part of this, the clergy, amongst others, media practitioners. Is it mandatory? They may be on the list, but should they take it? Are we under any law? Are we mandated by any law to take it? You have to unmute, Mr. Oponkuma. That's fine. We can hear you now.
Okay, so we are encouraging every Ghanaian citizen to take the vaccine because it protects you from the risk of severe disease. It protects the entire Ghanaian population and allows us as quickly as possible to get to a full sense of normal. so that things like our economy, our livelihoods can be brought back on track. So it is a very strong encouragement that we are putting out there to the Ghanaian population. In many countries where the vaccines have been introduced and there is a high level of uptake, I think, for example, in Israel, you notice that the rate of transmission is being cut severely because people have adhered to the encouragement and have taken the vaccine. So it is in our collective interest to do this. As we speak now, there is no legislation, there is no force of will compelling persons to take it. But I've been encouraged by the number of people who are reaching out to me on a daily basis since the first 600,000 doses arrived. I've been encouraged by the numbers who are reaching out and saying, can you get me in line for that shot? I hear you are talking about aged people and people with underlying conditions. I'm not aged, I don't have underlying conditions, but I want to take it and protect myself. So I think that if we focus attention on public education and encouraging people to understand the benefits, we may not need to even have any compulsory conversations about it.
Are you afraid
of
taking the vaccine?
No, I'm not. I've worked with these doctors and public health officials for quite a while now. Ghana's FDA, as has been mentioned, is very, very highly ranked and very, very careful in what they'll go about. This is the same FDA that when people brought RDTs for testing, did the work over and over and over again and did not approve any. This is the same FDA that is very quick to recall things from the market if they think that they are not meeting the standards. As I mentioned, this is the same FDA that has footprints working with the WHO, working with colleagues on the African continent and here in Ghana. So I have a lot of confidence in Ghana's Food and Drugs Authority. And once they have approved these two, and mind you, there are quite a number of vaccines, but these are the only two that they have completed work on and have approved. I have every confidence in the work that Mimi and her team are doing there.
Okay, let's get into the next batch of questions at this point. Yeah, we're ready. Let's get into it. So we're still on WhatsApp. This one says, is the vaccination mandatory? Okay, so that's Emma. That question has just been answered. And the next one, Charlotte says, again, we are not creating an entirely new vaccination infrastructure for COVID-19. We are leveraging existing infrastructure from polio, measles, yellow fever, etc., which were mainly for children. This time around, the population target is totally different. Adults will have to make decisions on whether or not to take the vaccines. With the conversation taking a religious turn, what is the strategy to first get people to accept the vaccine, and second, ensure the safe and effective deployment of the jabs? Ifia says, how much must I pay to be vaccinated? Echo says, which categories of individuals do not qualify? We have more? Okay, so do we have to pay to get the vaccine?
No, it's free.
Okay.
It's free for each and every one. Because it's public good. You know, all our vaccines in campaigns, whether it's for adult or children, routine vaccination is free.
Okay, and he's asking which group of people do not qualify. Earlier, we're talking about pregnant mothers.
Yes, everybody qualifies, except that we need a lot more data on safety for pregnant women and then children under 18 for the AstraZeneca, and for some vaccines under 16. So generally, I would say for children and for pregnant women. Yeah. But even for them, once we have data on safety, they would be covered ultimately.
Okay, and then there was one from Charlotte asking, it's taking a religious turn. Apart from the infertility issues, others are also saying other things. I'm sure you've heard about people saying it's a mark of the beast and all that. So it's taking a religious turn. So he's asking what strategy you're adopting to first get people to accept it, and secondly, ensure the safe and effective deployment of the jabs.
Okay, so thank you very much. Yes, we had to map up a lot of stakeholders, and one of the key ones was the religious leaders, a set of them. So through the ministry, they have been engaged. In fact, many of them have been engaged, and they assure us that they will start preaching in their pulpits, because we demystified all those mysteries that were surrounding the vaccine. And some of them had questions which we tried to answer.
What kind of questions did they have?
The same conspiracy theories about infertility and mark of the beast. Of course, they are best at it, because some of us we go to church, but no, we are not very right. So we try to demystify those things and encourage them to also accept it. And I mean, the assurance, once they understood and through our conversation with them, when they understood that, oh, after all, many of the things that people were saying are just mysteries, they are prepared to go along with us. So but of course, we are also doing a lot of advocacy things and meeting with other stakeholders. We've done some jingles, flyers, and some of these conversations are also part of it. We have a whole communication strategy in place. But the unit of operation is actually the district. So the bulk of the activity, the engagement, will be at the district level. And I know they have some volunteers and community mobilizers who are also supporting in mobilizing the community for a successful campaign.
Okay, so is it that we're going to set up stations, or we're going to get, just like we do for some of the vitamin A and all that, are we going to get people come to the homes? What exactly, within these 43 districts, are we going to get stations set up? How exactly is it going to be?
There are varied strategies for deployment. So we are using the stationed places like you're talking about. We call that static okay. clinics. And then, of course, they are also known as fixed. So all the health facilities within the district, both public and private, the big hospitals, the small hospitals, the medium-sized hospitals are all going to be used. We're also going to do what we call outreach services, where, if you remember, some health workers, vaccinators, move into the community, set up a mini clinic, deliver the vaccine, and then move out. They have designated places where they do these outreaches, so they'll do that as well. For some of the aged who may not be able to move out, the districts are planning to visit them in the house. Okay. Then, of course, for in future, going forward, for when those places that have islands are on board, we'll do what we call a camp out, where health workers park bag and baggage with all their tools and their the food and all that they will need. They go and sleep on the islands for about a week or so, finish, cover everybody, and then come out. So that's suited for the island. So we are using a multiplicity of strategies.
Okay, but curious, we have active cases of 5,444 currently as we speak, as put out by the president. Once we start this rollout, are we going to reach them as well? Are they going to get vaccinated? What exactly is the plan for those who already have the virus?
So if you have, okay, so normally, traditionally, if people are ill, irrespective of what illness they have, we defer vaccination until they are well. Okay. So for them, they are not a target. We will defer. So if it takes a week or two for them to get well, then yes, okay. Then we go back. It's for all vaccines, not just COVID.
Not just COVID. So once you are...
And it doesn't matter which illness. Once you are ill, we defer vaccination.
Oh, okay. So even these people that you've targeted, if you get to them and they have any form of illness, malaria, anything?
Yeah, especially febrile illness.
Which is?
Illness which makes somebody hot. I mean, the skin becomes hot and all that.
Okay.
Yeah.
So if you have a malaria, for instance, you can't be
we'll
vaccinated.
We'll defer. So if it takes you a week or so to recover, then we come back.
Okay. Okay. Interesting. Well, I'm learning a lot tonight, but let me take a quick break. And then once we return, we'll get into the next batch of questions. This is The Probe. Please stay. We are busting all the myths when it comes to vaccination tonight. Welcome back, and thanks for staying with us here on The Probe. Interesting conversation tonight. And I have with me Dr. Amponsa Chiano and, of course, Mr. Kojo Oponkroma, also via Zoom. We're having a conversation before we went on the break. Mr. Oponkroma, there was a question from Charlotte, but I'm interested in finding out how wide we've consulted on this whole vaccination process.
I think the consultation for this vaccination program is one of the most extensive I have seen. The expanded immunization program that Dr. Chiano runs has already got a whole network of stakeholders that they traditionally work with. Beyond that, the Ghana Health Service itself has also done a lot of extensive engagement, including academia, etc. And then when it came up to our level at the ministry responsible for information, we even facilitated one stakeholder session with public health experts, members of academia and civil society groups, a lot of the regular persons who are on your platforms giving perspectives, and got them together. I recall Dr. Chiano was there, went through the details, and they raised all their issues and their feedback, etc. Then we went for another level of stakeholder engagement with you, our colleagues in the media, and other persons in public health groups. The stakeholder engagements are now cascading down to the lower level, houses of chiefs, farmer groups, fisherfolk groups, local groups, etc. That level is now being led by the Ghana Education Service, the Information Services Department, the National Commission for Civic Education, and they are now also leading it through the regional and then the district levels. That will also culminate later in the community engagement and the public education campaigns as well. We've also, I think last week, engaged with the GJA, GIBA, PRIMPAG, to get our colleagues in the media trained on health reporting and health-related matters, because already we had started noticing instances of media persons, inadvertently sometimes making jokes and comments, but those jokes and comments, skew people's minds in a particular way. And also the fact, more importantly, that we need all hands on deck. And I think you heard the president talk about it, all hands on deck to get full support behind the public education exercise. So there's been an extensive engagement, but this is only the beginning. We're going to have to engage continuously, deal with what we expect to come up. You start hearing funny little stories that this happened here and somebody fell down and somebody's leg got broken and somebody's one eye popped off. You see a lot of misinformation spring up on, digital media as we start. So the regular interaction and engagement with all stakeholders is what will help us to curb the misinformation that will most likely come up as we go along, and also provide assurances to the Ghanaian population.
Issues that came up out of this extensive engagement with the various groups that you've interacted with so far?
I think one of the most dominant ones, or one of those that hit me the most, and I'm sure Dr. Chiano would recall, is the request from academia and the science community that while we go on with the vaccination exercise, on the parallel, the genome sequencing and research of the variants of the virus that we have or maybe developing should continue, and we need to make resources available for that, so that as we are going along, the general adverse effects don't become the narrative that everybody, or the potential adverse effects don't become the general narrative everybody takes on, but there's some more deliberate exercise in research as we go along. Another matter that has come in quite strongly is the fact that we need a very strong database for knowing who has taken the vaccine, what type of vaccine he or she took, when it was taken, when is the next one due, so that somebody doesn't take Astra in the first one and goes to take Pfizer in the second one, or misses the timelines because he's not been engaged and reminded to come up for it. And particularly for those who would like to be traveling, what are the international, let's say, electronic passports that are recognizing what vaccines, and how does what we are doing relate to that? All of those are very, very, very strong, genuine issues that have been raised by some of the stakeholders we have engaged. And I know that already the Ghana Health Service and the Presidential Task Force are working to answer the outstanding ones. Okay,
so Dr. Chen, I'm sure you can add to that. So if I take the AstraZeneca in this first batch of, vaccination, and then we get the Sputnik 5, how do I know, how would you know that I took AstraZeneca so I can't take the Sputnik? What exactly is the protocol in place for that?
Okay, so this time we're going fully electronic. Mm-hmm. So we have what we call the electronic tracking system. We've already done our modules, put on the tablets, and so that's what the vaccinators and the recorders will be using. So they will take details of every person, including the vaccine giving, the batch number, and the next appointment date. In addition to that, we're giving everybody a card, which also bears what the details of vaccines you've taken, and then your date for the second dose. Okay. So there will not be any issue, because, and for now, the policy is AstraZeneca first dose, AstraZeneca second dose. When we have Pfizer, we are giving Pfizer first dose, Pfizer second dose, because we do not have data now to support interchangeability. So for now, we are staying with the same vaccine for each individual.
So starting 2nd March, if I take this AstraZeneca dose, when am I supposed to get the
8
next
weeks.
dose? 8
That's
weeks.
2 months approximately.
Okay, 2 months after.
And you will get SMS reminders to come back.
Oh, you'll be reminded.
Yes, because we have everything tracked.
But if you are not within that district at the time, what then happens? Can you go anywhere else, or you will still be tracked? You'll come to you?
You have to come back, or at worst go to the nearest district where the same vaccination exercise is taking place. Because if you are in a district that is not doing the vaccination, then obviously you need to go to a
What if
district
you are
that
out
is.
of the country?
Then you need to make arrangements.
Okay.
And when you come back, or you take it where you are, it's the same, because you have all your details and you have a card with you as well.
If you don't take it within the 8 weeks, anything happens?
Well, you have the opportunity to take it at 12 weeks though. In vaccines, generally you don't have a maximum interval. What we have is a minimum. But when we have we have scheduled dates and you miss that, the only difficulty is that you may not get the maximum benefit, but you still get some benefit. So it's better to take it late than never. Yeah.
Okay, you ought to take the two.
You ought to take it.
The two.
Yeah, take the
okay.
two.
So, Mr. Fonkoma, earlier, Dr. Chano mentioned that taking the vaccine is free. There was a question I was asking whether we have to pay for it. So, if it's free, I'm sure the obvious question is, how much is this costing us as a country? We got the 600,000 doses for free. We had to facilitate its arrival and everything into the country and then the deployment. This entire process, there are questions about how much it's costing us if it is free.
So I'll let Dr. Chano deal with the numbers. They did the budgeting and submitting of same. But yes, you're right. There's a small component that came in for free, about 600,000 doses from the COVAX facility. But if you are targeting 30 million or 33 million Ghanaians, then it means that about 99% or 98% of it you may have to be purchasing. That's number one. Mm-hmm. Number two, because you have a portfolio of vaccines, and they all don't come at the same price, it means that the pricing is going to maybe at best be averaged, because prices range for sometimes between $3 and $40 or so. So Dr. Chanu can also give you the price points on that. Number three, and one of the things I've learned, and by the way, between Dr. Chanu and Dr. Samuaba, I'm now learning a lot about vaccines. One of the worrying things is that some of the vaccines that you read as having the highest efficacy levels, because of the technology used in producing those vaccines, those RNA technologies, they also require ultra freezing equipment, sometimes minus 20 degrees, sometimes minus 50 degrees. Some of them, you can't transport them like the ones that were brought in, like AstraZeneca, which can be brought in cold boxes. You need some ultra freeze equipment. So if you go for some of those, apart from purchasing it, then you have to also now invest in the ultra freeze equipment required. What that means also is that what Dr. Chiano mentioned, for those specific ones, you can't put them in an ice box and go across the river behind a pharmacy to administer it elsewhere. So you may have to, mount some clinics or stations with standby gensets, etc., to do that. It is in the midst of all that Dr. Chiano and his team are having to budget and request of the states to pay. But the president has given them his commitment that whatever must be done to protect lives and livelihoods of the Ghanaian, he's willing to do, but they will supply you the numbers.
Okay. Dr. Chana, over to you.
Yes, so first I'll talk about the operational cost. That is the cost that is going to be incurred in delivering to the final recipient. Mm-hmm. So we estimated that for every person, every individual, it will cost us about $2.6 to deliver the vaccine. But the cost of the vaccine itself is different. Mm-hmm. And as the Honorable Minister Designate said, we have a varying pricing depending on the vaccine. So some as low as $3.4, some as high as $33. So because you have a mixed bag of vaccines, it's difficult to estimate that. But when we use an average of about $10 per dose, then you are looking at 20 million at the start by 2. So that is about 40 million doses plus wastage, let's say 42 million. So if you multiply by 10, you are getting that kind of almost 400 and something. But of course, we're getting some free through the COVAX. And COVAX is giving us vaccines for approximately 20% of our population. So if you work the math, it's about 6.2 million people by 2, plus a wastage about 12 point something doses. When you take it out from the almost 42 million doses, then you get the rest will have to be borne by government or some other agency. And if you extrapolate to the 31 million, then obviously you are going to go high.
Well, we're starting on the 2nd of March. Do you have everything you need?
Yes, for now, the only thing that was militating against us delivering tomorrow was cards. But just as I moved from my office, the cards were delivered. So we are also sending...
vehicles?
The cards. The cards I told you that will give individual. Okay. Yes, so they have just been delivered and we are transporting them.
Okay, and I'm told you have an app as well.
Yes, the app is for reporting adverse events. As I told you, for every campaign, for every vaccine, you would definitely expect some events to occur. It may not necessarily be related to the vaccine. Anytime you take a vaccine, whatever happens medically after, people might think is a vaccine, but it may not be. So we follow all that, and then we send it to, we send the data to the Technical Advisory Committee for Vaccines and Biological Products, which has been constituted by the FDA. In fact, for now, because of the COVID, there's a special team or a special technical committee that will do that, aside the routine technical committee. So the FDA has put it together, and they are the ones who do what we call the causality assessment.
But are we offering some form of psychological support, for instance, before taking the vaccine? Is there
well, that is counseling as to what you should expect, what you should not expect, and what to do. Yes, definitely at the point of vaccination, and then also as part of the communication on the airwaves, we'll do that as well.
So it's an injection?
Yes, people will have to be psyched up, you know, adults fear injection and so all that, you know. Somebody sees hypodermic, just the needle, and, and she's collapsing.
Okay.
Yeah, so we have to pep people up. It's just a small prick, and once nurses and other health workers are well trained, you might not even feel it.
I know why I'm laughing. Yeah. But I have a question here. It's asking, I have G6PD full defect. I'm also hypertensive. Can I take the vaccine?
In fact, hypertensives are those who are, even the vaccines are meant for. Are the people with underlying conditions, because they are the ones who bear the brunt of COVID.
And yes, G6PD.
G6PD, yes. For the guidelines that we have, there's no problem with G6PD, unless maybe with time when we deliver the vaccines to a very large number of people and we see some. But for now, there's no problem with that.
Okay,
and so they are also part of it.
Earlier, I asked about HIV and then sickle
Yes, HIV is they are also part of those with underlying conditions. If you look at the guidelines that have been circulated by the Strategic Advisory Group of Experts on Immunization, who support the WHO as well as the member states, it's clearly people with what we call people in immunocompromised states may not seroconvert or have the full benefit, unlike people who have who do not have it. But of course, it's better for them than not to give them at all, because the immunity is already compromised. That's the reason. Okay. So they may not be able to seroconvert as much as possible. Well,
there's also a question about whether we can check the older age at which we cannot take the vaccine. But there's some concerns that the AstraZeneca vaccine should not be given to people older than 65 years.
Well, some people have been reporting that, but as far as we know, it is for people who are above 18 years, irrespective of, I mean, there's no upper limit. And so for us, we are comfortable with that. And we're going to give it to the elderly as well. And because they need it most.
Okay. Yeah. So above 65, it's okay?
Yes, it's actually, for now, because of the segmentation, we are targeting people 60 years and above. But of course, all the other targets that we mentioned will still be between 18 and 60. So.
Well, at this point, our radio audience will leave us, but we are still live on JoyNews and then also on social media. We're giving you some more time so we can take a lot of your questions so that we can bust all the myths when it comes to the vaccination of COVID-19 in the country, starting on the 2nd of March. The president, his wife, the vice president, his wife, judiciary, clergy, they are starting tomorrow, which is the 1st day of March. We all remember this day in our history as a country when we first recorded COVID-19 and the first announcement, update number 1 that was given by the president. But let's get into the next part of questions now. But Ms. Oponkoma, before we get into it, just today we heard that the U.S. had just approved the Johnson & Johnson, vaccine, which can be stored at a higher temperature. Are we looking into that as well? Because during the WHO press conference last week, they mentioned that Sputnik, they are yet to get all the works done when it comes to that, even though we are hoping to bring it into the country. Are we looking at this as well, since it's easier to store?
So the Food and Drugs Authority has reported to the Presidential Task Force that they are studying the documentation and other related matters on Johnson & Johnson, and they will advise in due course what the next steps will be. That's what I can say on that one for now. I just want to mention something that may have come up in passing. Before you take a shot, your details have to be collected, and that's what Dr. Chen was talking about. I think from the dry runs that have been done, it takes a bit of time to get all the composite, details on an individual. So people should stack up their minds that you spend a few minutes making your details available and don't just get, anxious as a result of that. But in addition to Johnson & Johnson, the FDA is looking at other vaccines that have received WHO approval and then sometimes approval from other countries. And it is only when they are satisfied with it that they will certify it or give it approval to be used here in Ghana. Okay. What it will do is that it will increase our portfolio of vaccines and make it easier for us to reach this 20 million target by the end of the year, and hopefully the entire population in the medium term.
Dr. Shani, you want to add anything to this? The Johnson & Johnson, we are told it's a single jab as well.
Yes, we are happy about it. Once FDA reviews the dossier and thinks that we should go for it, why not? Because it will be more cost effective and, of course, easy to store. Yes, as AstraZeneca is easy to store because we have the structures in place. Okay. So we are happy about it.
Yeah, let's get some more questions at this point. We're still on WhatsApp. Esnam, are the vaccines efficacious against new variants of the virus? Kwame says, how is the ministry working with faith-based organizations to demystify the belief that vaccinating earns you the mark of the beast? Maoli says, what is the approach for SHS students who are still in school? Francisca, how will people with underlying health conditions prove it? Will they have to get a note from a doctor and sent to a particular center? If so, where? Okay, so Francisca's question, very key. How would you have to prove if you have an underlying health condition? Where do you take it?
Yes, so as I told you, the district is a unit of operation. They know their people best. But for us at the national, what we tried to do was to get data from the big hospitals, like Onfanoche, Kolebu, which they supplied. So we have an idea how many of such people go into the hospital. And so that's the first point of call. But as I did indicate, the districts also have hospitals with dietary clinics. I mean, clinics that attend to these so-called chronic ailments. And they are liaising with them. I know they have taken the data as well, so they identify it. We also asked during our meetings and training with them, we also inquired from them how they're going to do this. And they assured us that even for the elderly, they will link up with the churches and so on. But for if you do not know your condition, then obviously you can't get the vaccine because you do not know. So it's people with known underlying conditions.
But if you know, and maybe you need to show anything to...
Yes, otherwise anybody who probably wants the vaccine will go and say, I have this.
Okay.
So at least your doctor should give you some indication that or some evidence that you have this disease. And since they are also going to work with all the facilities, both private and public, we are confident that they would identify such people. However difficult it will be.
Okay. So Mauli is asking what the approach for SHS students who are in school is, assuming that they are above 18.
Yes, for now, they are not in the segmented population. But subsequently, when we get additional vaccines, and of course we said that we are vaccinating the entire population, except those who, for now, we do not have data on safety for them. And if they are in school, it's even easier to vaccinate. Normally, when we are doing campaigns, it's the schools we target first because it's a low-hanging fruit. It's very, very easy to get them, so that one shouldn't be a problem at all.
Okay. And Desina was asking how efficacious these vaccines are against the new variants.
Yes, I'm sure she's probably talking, or he or she is talking about the South African. Fortunately, we have almost 99% of our cases being the UK type, which is responsive to the vaccine. So the issue is we need to deliver or deploy the vaccine within the shortest possible time so that we don't have the strains, as it were, replacing, or what do they call strain replacement. So we need to act fast. That's why we're acting fast. This is the first time we have had a vaccine, and we've trained people the same day, and within 4 days or 5 days we are deploying. It's never happened before. This is unprecedented. Okay. Because we are not in normal times.
Okay. There was another question that I've just missed at this point, but we are told also, there's another one that I'm seeing here from Kay. It says, does the country intend to pursue compensation for pernicious side effects upon vaccination?
Okay, the issue of compensation is a very tricky one. For us, as I indicated, we monitor safety, and therefore we follow adverse events. Anybody who gets adverse event is treated free of charge. A government bears it. It's not just because of COVID. It's always been the case.
Okay. So once you bring up any side effects,
and you go to the hospital, it may not even be related to the vaccine at all, but all the bills, if it's not absorbed by the national insurance, is taken up. So the regions collate and send to the national level, and it's reimbursed.
Is there a particular place that you have to go?
No, for you, once you get to the hospital, if you have a challenge, let the district director of health services within the district know about it. They are aware that that policy has been in existence since I joined the program. Okay. And then they would in turn liaise with the deputy director of public health or the regional director. And we've been doing this quite well over the past, God knows how many years, 20 or 30 years or so.
Okay, so there's one also that's asking, does the vaccine have any side effects on pregnancy if a vaccinated husband sleeps with a pregnant wife? Because the pregnant person is not supposed to take it. So if your husband...
No, the vaccine is not secreted in semen.
It's not?
No, it's not secreted
in
sure? Semen. Yeah, very sure of that. It's not secreted in semen. But of course, it's also not a live vaccine, so there's no... I don't think that it has the potential to cause that. But yes. You see, some of these ineligibility are all theoretical, because I remember during yellow fever campaigns, normally the yellow fever is contraindicated in pregnancy. But we've had a lot of pregnant women who were inadvertently vaccinated. We followed them up, not just in Ghana, across the globe. Nothing happened. So they are theoretical. It's only a matter of erring on the side of safety. So it's as somebody would say, being doubly sure. Okay. That's why we exempted them.
Well, I saw the minister laughing. Mr. Ponkuma, that's somebody's question. But there were issues about compensation also that people were asking earlier, whether we are hoping to pursue the side of compensation if you come up with any side effects once you take the vaccine.
So unfortunately, I'll have to leave you because as you heard the president mention, tomorrow he's taking, the vice president is taking. So we have a few things to do shortly. But I think Dr. Chiano has been quite clear that there could be adverse effects. Adverse effects don't necessarily mean that the vaccine has had a negative consequence on you. It could be purely coincidental. But even if there's an adverse effect, the public health system is able to deal with it and absorb the cost accordingly. I'll end by reiterating the president's charge. We all should endeavor to take the vaccine to protect ourselves and to help get our economy back on track as quickly as possible.
Okay, but briefly, just before you let us off, because of tomorrow's program, for instance, we're curious. What form will it take? How is it going to be like? Because a number of them are going to be taking the jab. Maybe you could briefly walk us through what to expect tomorrow.
Oh, I mean, it's like if the president was going to hospital to an OPD visit and was going to take a shot. So he will attend one of the medical facilities. And the doctors and nurses there will receive him and give him the education and the briefing, as they will give any person who appears for the jab. And he will take his jab live on national television alongside his wife. The vice president will also do the same at another facility alongside his wife as well. And then on Tuesday, a number of other dignitaries, as has been outlined, will also take this publicly.
Okay, we'll leave you. Thank you so much for joining us. That's Mr. Oppong Nkrumah, Minister Designate, helping us understand some of the issues that came up during the President's address. And Dr. Amponsa Chano is with us in the studios. We'll take more of your questions. We'll go on Facebook also, and then also on Twitter. Most of you are watching there. If you have any questions, this is the time to ask them, so that once we start on the 2nd of March, you are sure of what to expect when they come to you to vaccinate you. So yeah, if you're ready, let's go into the final batch of questions at this point. We've seen that you've sent in some questions once we rectify that, but this one also says the president said pregnant women and children can't take the vaccine. Are they not contracting the virus, is the question that he's asking.
Yes, that's a very legitimate one. But the point is that, as I told you, for vaccines, it's safety first. And once we don't have data on safety, you want to err on the side of safety as well. Therefore, you would wait until such time that we have data, enough data to cover. And then, currently, as I speak, there are studies going on, trials going on in children and pregnant women. And in no time, I'm sure we would have that kind of data to back whether we need to vaccinate them
or not. Okay. Well, let's take a quick break, and then we'll get into the final batch. Then we can call it a wrap for tonight. And this is the final leg. I take you straight to Facebook, then thanks for staying with us. Dr. Amponsa Chano is on hand to take the final batch of questions. He really has to rush out of here. But this one from Sami on Facebook: how many doses can be administered from one vial? Are all 60,000 doses going to be administered, or 30,000 doses are going to be administered, then the rest of the 30,000 administered after 8 weeks? And then 3, when are we expecting the next batch of vaccines to arrive? I think he's been speaking to the third portion of your question, but we'll take answers to the first part. Yes. He's asking how many doses can be administered.
Yeah, it's a 10-dose vial, so
10 doses.
Approximately 10 people will take one vial.
Okay.
But there may be some wastage, so normally it's around 8, 9.
Okay. Yeah. And then all the 60,000 doses?
600,000. Yes, we are giving them as first dose, because we know within the next 2 weeks, maximum 1 month, we'll get a second tranche of vaccine.
Okay, so we're administering all?
Yes, all.
All 600,000. Yeah. Okay, so we have one from Boyson. It says, if I get vaccinated, can I stop wearing a mask? And if I get vaccinated, will the restaurants, bars, schools, fitness clubs, etc. reopen, and will people be able to go back to work like normal?
Let me answer that before you continue. Ultimately, that's what we are hoping for, and that is why we need to go for the vaccine. Because for now, because it's the early days yet, we need to still adhere strictly to the preventive or prevention measures. And so I would say that for now, we will not take off the mask, but not until we all go for the vaccine within the next 7-8 months, where we have a critical mass of people who are protected, and therefore will protect the others, including the pregnant women, which we call herd immunity. Normally, when there's population immunity, it means if the pregnant woman is not even vaccinated, once almost all the people are vaccinated, she is protected as well. Okay. And ultimately, we'll start opening up. Not until that, we need to still adhere to the protocols. Okay.
And then another question: if I get vaccinated, will I be resistant to COVID?
That is, will it protect you? Yes, it will.
It will.
Yes,
okay.
and it either protects you from getting severe disease or moderately severe disease, or you won't get a disease at all.
Okay.
Yes.
And he won't be contagious to others, he asks.
For now, it's not very certain.
Okay.
That is why we still have to, as it were, put on the masks, wear our mask, and then do the hand hygiene and so on.
Okay.
But ultimately, once we break transmission, nobody is afraid anymore.
Okay. Well, Ben has joined us via phone. Ben, briefly, you give us your questions, then we can take as many calls within the next 5 minutes. Ben, good evening.
If I am infected, will I be taking the virus? And if the answer is no, then will I be tested before giving the virus? Because I don't know whether I am infected or not.
Okay, valid question. Thank you, Ben. We have one from Akosombo also joining us. Hello.
Hello.
Good evening.
Madam.
Welcome. Please, your question.
Thank you. Please, my name again is Abdulaziz Adema. I wanted to ask about the vaccine, the age, from which age are they going to vaccine?
Okay. Thank you. Thank you. We'll take answers to the first two callers. And then it says if he's infected.
Yes, so if you are infected, you will still be vaccinated. So the second question doesn't apply.
Okay, that you don't need to
you don't need to
before.
test everybody, because science, the science suggests that your immunity even gets better when you get infected and you get the vaccine.
Okay, and the age?
Then the age range is above 18 for the AstraZeneca.
Okay, all right. We have one more caller. Hello?
Or 18 and above,
Joel,
so to speak.
Welcome, Joel. Your question, please.
Yes, I'm Joel, calling from Cape Coast. Please, I want to find out if maybe somebody has recovered from the COVID, can he still go ahead and take the vaccine?
Okay. Thank you, Joel.
That's what we just answered. Okay. Recovery means you've had an infection.
You've had it. So no, but the first caller was asking if he's infected, he has the COVID now.
Yeah.
Can he take the vaccine?
So if you have it now and you have signs and symptoms, generally when you have signs and symptoms, irrespective of whether it's COVID or any other disease, we defer vaccination. I think we mentioned it earlier.
Yes.
If you are infected and you have recovered, you still get the vaccine.
Okay. All right. Well, Amwa, welcome. Your question, please. Hello, Amwa.
Yes.
Good evening. Your question.
Yeah. I'm a community health nurse. I want to find out, we will be doing most of the work. I want to find out. Yes.
We can hear you, Amwa. You would have to turn down the volume so you are not distracted.
Good.
Okay, it appears we lost Amwa. Samuel, welcome.
Yeah. Hello.
We can hear you, Samuel. Your question, please.
Yeah, I want to find out. I just heard Dr. Chano saying that they want to give the vaccine to everybody, the 600,000 doses that have come. So that's assuming if one person receives the first dose, and then the second batch will not come, and the vaccine finishes, maybe different vaccine will be coming, the Johnson & Johnson or whatever. Where are we going to get the second dose? Or will they be given, will that person receive the other vaccine that will be coming as a second dose?
Valid question. Valid question. Thank you. Imelda, welcome.
Yes, good evening.
Your question, please, Imelda.
Please, I'd like to know what the plan is for pregnant women that's already been infected. Since it's said that pregnant women can't produce the vaccine, what happens to those mothers that already have the virus?
Okay, so Dr. Chano has been answering if you have the virus and you have symptoms, you cannot get the vaccine. But the question that Joel or so Amo is asking is that if you're administering all 600,000 right now, what if you don't have, because you don't get it again? What happens?
I told you that the shipment on the way within the next maximum 4 weeks we'll get it.
What if anything happens to it? That's the question.
Well, we are getting 12 million doses in batches. So if something happens to the second batch, definitely the third batch will come. I mean, we went through a lot of thought processes before we agreed on this.
Yeah, okay. So Leonard, welcome.
Good evening.
Your question, please.
People who are doing education for this, is it the help from others also helping in education?
Okay. All right. Great. Thank you, Leonard. Ben, let's add Ben quickly, and then Dr. Achiano can add that. Hello, Ben.
Yeah, my question is, how about those who will refuse to be vaccinated? What happens to them?
You can't refuse, we beg. That's what we've been told. So Ben, thank you, but Dr. Achiano will give you a response to that. We are grateful. So education on it. So the health nurse was, we had a caller that we lost along the line. I'm sure she wants to find out the priority, I'm sure, I don't know, but that's one concern also, at least those who will be administering. What exactly is the protocol in place for them? I know they are part of the group.
Yes, you mean those who are the vaccinators themselves? Yes, so, you know, in the era of COVID, when you are doing anything, you need to protect yourself. So we've provided them with face masks and hand sanitizers. So that, like, we did a campaign, about 4 campaigns last year within COVID. And we provided them always with the face masks and the hand sanitizer. We've trained them as well. Of course, they will take their own jabs as well. So it's all a form of protection.
Okay.
The education, I didn't quite get that question, but
is it intensifying education?
Oh yes. So he's also part of the system, and so we have a lot of structures in place. As I said, the district is a focal point. It's a unit of operation, so they use multiplicity of strategies. They do the information centers, they send letters, they do they use mobilizers as well. They even beat Congo, depending on where you are.
But I haven't had any information van in my area.
Yes, I know the NCC and the Information Service Department are working on this together with us.
But it's starting on the 2nd.
Yes.
If we are yet to hear anything really.
I think that maybe where you are, I'm not too sure where you live, but probably you haven't heard it because it hasn't been intensified. But I know it's going on.
Okay. Yeah. And the last caller is saying if he refuses to...
Yes, we only will encourage. As of now, we don't have any legislation asking people, suggesting that it is compulsory. So we only encourage. Normally, even for childhood immunization, there are laws.
But we have the Public Health Act.
Yes, we don't usually enforce it.
Why not?
You know, sometimes your attempt to do that even backfires because people are speculating, and so eventually I say, okay, that's why they are making it compulsory. So we are cautious doing that. There's no legislation yet. However, what I know has been done in some countries, like UAE, if you refuse to be vaccinated, fine, that is okay, but you have to do test weekly, PCR at your own cost before you enter any premises. And so eventually you go for the vaccine.
Okay. Well, interesting.
So I'm sure it will come here.
Of course, we can't take all the questions today, but at least we've been able to bust maybe up to 80% of the myths when it comes to COVID-19 vaccine. But just in case someone is just tuning in, we have 30 seconds to go. Maybe you tell them why they need to get vaccinated.
Yes, vaccines save lives. That is the first thing, and we have evidence to show. Remember, some of us, our mothers tell us that we had all kinds of diseases. I remember, not long ago we were discussing it. I had measles, chicken pox and all that. It's only by the grace of God. Now, even measles, you don't see it anymore. And the young doctors who have just passed out, I'm sure it will even be difficult for them to diagnose measles. Yellow fever is virtually gone. Polio, wild polio has been eradicated, all thanks to vaccines. Yes, vaccines save lives. So that is why, if we really want to get back to normal, it is vaccination is the key, and therefore we encourage people to patronize this.
Thank you very much. That's the program's manager, expanded program on immunization at the Ghana Health Service, Dr. Kwame Amponsa Achiano, my guest tonight on The Probe. Let's do it again another Sunday. I am Emefa Pau. There's more news when you log on to myjoyonline.com. Thanks for your company.